I'm an ophthalmologist. I look after patients with glaucoma at Moorfields Eye Hospital. That's one of the largest eye care organizations in the Western Hemisphere. I lead a group that does data science research. We take lots of different data-driven approaches to better understand glaucoma, with the aim of ultimately being able to better treat our patients with glaucoma. And really, we needed help from Topcon to be able to, for example, segment the retina into the different layers and give us all of these numbers, the thicknesses of the different layers for us to analyze in relation to eye health and systemic health. And that's been a game changer. I'm sure you've seen on the news some of the studies showing that some of these layer thicknesses associate with diseases like Parkinson's disease and schizophrenia, multiple sclerosis. And really, this has revolutionized the field that has shown that even on a population level, eye scans are giving us some information about important systemic diseases. And I think that's just a good example of how, with this huge population level data and that level of detail, we can now really start to understand, well, how does the retina develop and how does that translate into visual function? How do we all vary normally so that we can better pick up changes that are happening with disease? The little old eyes are actually the window to very accurate measurements of blood vessels, of neuronal structures that is informing systemic health. So just from a fundus photo now, there are multiple algorithms that will segment out the vessels and measure so many different attributes of the vessels. And these have been shown to strongly correlate with other systemic parameters such as metabolic health, obesity, and I think it's highly likely in the future that a simple scan of the back of the eye, probably from a Topcon device, if you're putting this in the community where you need something to be easy to use and with the robotics, so it's automatically captured, will inform the care of many systemic diseases. So it's a really exciting time. We need a device that is easy for technicians who are not trained and not specialists to use. And that might be, nurses or technicians in a primary care setting, or in a supermarket, maybe even having something completely automated. And so I think what's exciting about the devices Topcon are building is the robotics. And I've only learned this recently, actually, but Topcon isn't just healthcare. And actually, another major part, I think a bigger part of Topcon, is robotic devices in agriculture that use GPS signals to best achieve what they need to achieve. And so Topcon's really ahead of the game in terms of robotics. So I think if we are going to get eye scans out of the specialist centres and there into the general population, that's one thing we need. Another thing we really need is openness. We need that data to be able to freely flow. Even if it's a Topcon device that's collecting the data in the community, it shouldn't have to be a Topcon software or whatever that's picking it up elsewhere. And I think that's always been the ethos of Topcon, that things should be open and shareable.